Anxiety disorders and trauma. Understanding the connection and effective treatment strategies. Trauma is a significant risk factor for the development of anxiety disorders. Understanding how trauma contributes to anxiety and identifying effective treatment strategies is essential for supporting individuals on their healing journey. This video explores the connection between trauma and anxiety disorders and highlights effective treatment approaches for trauma-induced anxiety. The connection between trauma and anxiety disorders. Hyperarousal and hypervigilance. Trauma can lead to a state of hyperarousal, where individuals are constantly on high alert and sensitive to potential threats. This hypervigilance can contribute to the development of anxiety disorders, as individuals may experience persistent fear and anxiety in response to perceived dangers. The body's fight or flight response may be perpetually activated, leading to chronic anxiety and stress. Intrusive thoughts and memories. Trauma survivors often experience intrusive thoughts and memories related to their traumatic experiences. These intrusive thoughts can trigger intense anxiety and panic attacks, further exacerbating anxiety disorders. The constant replaying of traumatic events can make it difficult for individuals to feel safe and secure, leading to ongoing anxiety. Avoidance behavior. To cope with trauma-related anxiety, individuals may engage in avoidance behavior, steering clear of situations or stimuli that remind them of their trauma. While avoidance can provide temporary relief, it can also reinforce anxiety and prevent individuals from fully processing their trauma. Avoidance behaviors can limit individuals' lives and contribute to the maintenance of anxiety disorders. Negative thought patterns. Trauma can lead to the development of negative thought patterns, such as catastrophizing and overgeneralization. These cognitive distortions can perpetuate feelings of anxiety and increase the likelihood of developing anxiety disorders. Negative thought patterns can create a cycle of fear and worry, making it challenging for individuals to break free from their anxiety. Effective treatment strategies for trauma-induced anxiety. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach that helps individuals identify and change negative thought patterns and behaviors associated with anxiety. CBT techniques, such as cognitive restructuring and exposure therapy, can be particularly effective in addressing trauma-induced anxiety. Through CBT, individuals can learn to challenge and reframe their anxious thoughts, reducing their impact on daily life. Eye movement desensitization and reprocessing, EMDR. EMDR is an effective treatment for trauma-related anxiety. By using bilateral stimulation, EMDR helps individuals process and integrate traumatic memories, reducing the intensity of anxiety and panic attacks. EMDR therapy can help individuals gain a sense of control over their traumatic memories and reduce their emotional impact. Mindfulness-Based Stress Reduction, MBSR. MBSR combines mindfulness meditation and yoga to help individuals become more aware of their thoughts and feelings. This increased awareness can reduce anxiety by promoting relaxation and emotional regulation. MBSR techniques can help individuals develop a more balanced and mindful approach to their experiences, reducing anxiety and stress. Medications, such as selective serotonin reuptake inhibitors, SRIs, and benzodiazepines, can be prescribed to manage symptoms of anxiety disorders. These medications can help regulate neurotransmitter levels in the brain, reducing anxiety and improving overall well-being. Medication can be used alongside therapy to provide comprehensive support for individuals with trauma-induced anxiety. Exposure therapy. Exposure therapy involves gradually and systematically exposing individuals to anxiety-provoking stimuli in a controlled and safe environment. This exposure helps individuals confront their fears and reduce avoidance behavior, leading to decreased anxiety. Exposure therapy can help individuals build confidence and resilience in the face of their fears. Case studies. Case Study 1, CBT for Trauma-Induced Anxiety. Emily, a survivor of a natural disaster, developed severe anxiety and panic attacks. She began cognitive behavioral therapy, which helped her identify and challenge negative thought patterns related to her trauma. Through exposure therapy, Emily gradually confronted her fears, leading to a significant reduction in her anxiety symptoms. The combination of cognitive restructuring and exposure allowed Emily to regain a sense of control over her anxiety. Case Study 2, EMDR for Trauma-Induced Anxiety. John, a survivor of a violent assault, experienced intense anxiety and hypervigilance. He underwent EMDR therapy, which helped him process and desensitize traumatic memories. As a result, John experienced a reduction in anxiety and panic attacks, improving his overall quality of life. The structured and targeted approach of EMDR enabled John to address the root causes of his anxiety and achieve significant relief. The connection between trauma and anxiety disorders is well established, with trauma significantly increasing the risk of developing anxiety. Understanding this link and identifying effective treatment strategies is essential for supporting individuals on their healing journey. Therapies such as CBT, EMDR, MBSR, and exposure therapy offer promising strategies for addressing trauma-induced anxiety. Medications can also play a role in managing symptoms and improving overall well-being. By integrating these approaches into treatment plans, therapists can provide comprehensive support for trauma survivors, promoting recovery and resilience. A holistic approach to treatment can help individuals manage their anxiety and lead healthier, more fulfilling lives.